The coronavirus has claimed the lives of more than 1 million people. But experts caution that the true figure is probably much higher. The grim milestone has been officially recorded by the Johns Hopkins University database. It shows the virus has spread to at least 188 countries, and fatalities have been rising through most of August and September. After weeks of gradual decline, many countries are seeing a resurgence in coronavirus cases, including here in Europe. Experts say that the crisis is far from over. Now let's take a look at the countries with the most deaths resulting from COVID-19. They are the US, Brazil, India, Mexico, the UK, Italy, Spain, France, and Iran. But if we look at the number of deaths as a proportion of the population of each country, we get a better indication of the impact of the virus. And you can see the list is slightly different. It includes Peru, Belgium, Bolivia, Spain, Ecuador, Chile, the UK, Brazil, the US, and Italy. Well, let's focus on one of those countries, Belgium. The government there has been criticized for being too slow to act, but the high per capita death rate may also be because of a statistical quirk. Belgium has a broader definition of deaths caused by the virus, which makes its figure higher than in other countries. But no matter how the statistics stack up, every coronavirus death is a human tragedy. DW's Terry Schultz reports now from the Belgian town of St. Truden and one family's heartbreaking loss.
The world has lost 1 million lives. One of them meant the world to 10-year-old Lorenzo.
My grandpa was the best.
His grandpa Luke picked him up from school each day.
And what did you guys do?
We made homework, and after that, we just laid in the couch and just did what we want to do. Mostly I got snacks.
But their hometown, St. Truden, was hit early and hard by the coronavirus.
We had 53 people who had to enter the hospital, and we only had beds for 20 people.
But Luke was already hospitalized, failing fast.
He said, if I don't make it, please take good care of the children.
He didn't make it. On March 23rd, Luke became St. Truden's first corona death. Janine, their daughters Nella and Lane, and Lorenzo didn't even get to say goodbye.
He had it really hard. It struck us really hard. Yes.
Mayor Veerle Heren felt it personally. Her husband became critically ill, but survived.
It was a terrible time for the families, but also for us as a mayor, but also all the people, my policemen, the people in the town who were working 24 hours a day.
6 months later, St. Truden has the infection rate under control with strict measures. Father Wim Kuenen says now inhabitants need to heal.
It's important that we share with each other what we feel, what we want, our anxiety, but also the good things.
Mayor Heren decided to create a space for that. A corner of a city park is now a memorial. The theme, Forget-Me-Not. Plenty of those flowers have been planted by city landscaper Didier Summers, along with a tree of life and a plaque bearing a poem.
In a hard winter, the flowers will come, so yeah, even when it's sad, it will be a little bit beautiful.
For the memorial's dedication September 13th, Lorenzo was asked to commemorate his beloved grandfather. He told his mom Nelle he was too afraid.
Because I thought they were gonna laugh at me.
But Lorenzo changed his mind and wrote Luke a letter.
Lieve opa, dear grandpa, I miss you very much. I am mad about Corona, mad about what happened. You were the best and always are gonna be the best.
What did you think when you saw yourself up there?
That I was brave and that I was happy that I did it, that I could throw it all out. I was just happy. Everyone was.
That's right.
Even my grandpa.
No one here will forget them.
Joining us now is Dr. Margaret Harris, spokesperson of the World Health Organization in Geneva. Thanks for being with us this morning. Dr. Harris, 1 million people are known to have died from COVID-19 already, and the pandemic is far from over. How much further do you expect the death toll to rise?
Good morning, Terry. We want the death toll to stop. We want the transmission to stop. We know that we've lost at least 1 million people, probably many, many more, because many deaths have not necessarily gone recorded as coronavirus deaths, as COVID deaths. But what's really important now is that we all know so much more about this virus, so much more about how to stop it. What we're still lacking is that all of society, all of government response in every place to really do the things to turn it around. But it's not too late. We can fight back.
Talking about fighting it, there are various therapies in development to at least prevent the infections from becoming lethal. Synthetic antibodies, for example. Do you see anything promising in the pipeline that could become widely available soon?
Yes, in fact, there's an enormous hope in the fantastic work that scientists have done on all sorts of fronts, the diagnostics, the treatments, and the vaccines. And when it comes to the treatments, we already have some treatments that can stop the severe effects when people get the severe form of the virus. And our doctors and nurses are becoming very good at recognizing when somebody is going into that stage and getting treatments like corticosteroids, but also the blood thinners that stop the clotting, which can cause a lot of problems. So definitely we have learned medically and clinically how to fight death. What we also now have to do is fight transmission.
You mentioned the importance of the international community working together on this. How difficult is it to coordinate the fight against this pandemic when countries are taking very different approaches, ranging from hypervigilance in the case of South Korea to denial in Brazil?
Well, certainly it's critical that every person on this planet understands that this is a threat to humanity. This is not about politics. This is not about one group against another group. This stops when we all stop it together. We do know what stops it. We know that for individuals, you do the hand washing, the physical distancing, the mask wearing when you're in close contact, and avoid crowds, avoid gatherings where you're all together. We know this stops it. We know that governments can stop it by doing good tracking, tracing, testing, but we all have to do it all. It's not just a matter of saying the government has to do this or this person has to do this. It has to be all of us doing all of it.
Now, numerous vaccines are in development. Can you tell us when we can realistically expect a vaccine that you're sure is effective and safe?
Well, we're at a very promising stage with quite a lot of vaccines. We've got 9 that have gone into what's called the phase 3 trial, where you test it on half people get it, half people don't, and they go out basically into the wild, into the community, and you see if it really, really protects. Now, while you're doing that, you're also looking very, very closely at safety. So the important thing is to gather all that information and look at, first of all, is it truly safe? And is it efficacious, and who does it work for? And then once you've got that data, you look at, we can roll it out. But we're not really going to get that information until the end of this year, beginning of next year. And of course, rolling it out will still take a while. But, you know, the signs are very good.
Dr. Margaret Harris from the World Health Organization in Geneva, thank you very much.
It's a pleasure.
Well, here in Germany, Chancellor Angela Merkel is due to meet the country's regional leaders to discuss a fresh strategy for combating the pandemic. Merkel on Monday said current trends could lead to a major spike in infection rates before Christmas. But just how ready is Germany for a second wave? DW visited one doctor's office in the center of Berlin that's hoping to get ahead of the curve.
12 meters long and growing. That's the length of today's line at a medical practice in Berlin. People have come here to get tested for corona through the window. No appointment necessary.
I think it's a really nice option, and it doesn't take so much time, and it may be safer than going to a hospital and sitting in the closed space where patients can be sick, but here everyone is wearing masks and it's just through the window, so I think it's really nice.
Dr. Sibylle Katzenstein runs the practice. She's bracing herself for a harsh corona winter with many more patients to deal with.
I
don't want to be a prophet of doom and gloom, but the numbers are clearly going up. We all want to prevent another lockdown, so we don't want to have to close the schools again. Somehow we've got to get through this winter. To prepare for what's coming, Germany wants to set up more testing stations. They would receive people running at a high temperature or with other corona symptoms. Additionally, the Public Health Office, which tracks infected people, was promised more personnel. But that has yet to materialize. Politicians have pledged to bolster the health authorities over the next 5 years. This requires the creation of 5,000 new jobs. But now, as October and November approach, the jobs don't yet exist in the health offices. This is a problem that urgently needs to be addressed. But instead of relying solely on Germany's healthcare and tracking system, Dr. Katzenstein would rather make testing at home possible. People have to be given the chance to do a test without a doctor, to go to the pharmacy and buy a test. Although they do not guarantee 100% accuracy, they provide an excellent indicator and are absolutely adequate from an epidemiological point of view. The swab test involves taking a sample between the nose and mouth. It shows the result within 15 minutes without sending the sample to a laboratory. In Germany, though, only doctors and pharmacists are allowed to order them. Should infections start rising sharply in winter, they might be an alternative to long lines in the cold.
Let's bring in our political correspondent, Hans Brandt here. Hans, infection numbers are climbing again in Germany. Today, Chancellor Merkel is meeting regional leaders to hash out a fresh anti-corona strategy. What can we expect?
Well, there have been some leaks about what is likely to be decided today, and it looks as though the restrictions will be tightened again. What they're talking about is that the number of people that are allowed to attend private parties, for instance, will be restricted to 25 and public gatherings to 50. The background to this is that in recent months or in recent weeks, the number of infections have risen, especially because of gatherings such as religious gatherings, wedding parties, birthday parties. In other words, things that are happening really outside public control in private circumstances. But these kinds of gatherings are to be restricted. We have to say, however, that there is some dispute between the various regions, the 16 federal states in Germany, amongst each other. There is a push to have these rules imposed for the whole of Germany, but especially the rural federal states feel that in their cases, where the number of COVID cases are very low, applying such strict measures would not be reasonable. So there is some dispute going on about whether this will be for the whole of Germany or not.
Well, of course, many people are concerned that there could be a real spike in infections, and statistics suggest that is possible. If that happens, could there be another hard lockdown in Germany?
Well, Angela Merkel, the Chancellor, is one of the people who is concerned about this. She said yesterday in a party meeting of her Christian Democratic Union that if nothing was done now and the exponential growth of infections continues the way it has been in recent weeks, then by Christmas we would have 19,000 infections per day. That's obviously a very bad worst-case scenario, and also a lockdown, a total lockdown, would be a measure of last resort. That is something that the government will try to avoid at all costs. But what is possible are regional lockdowns, possibly even in sections of certain cities, such as here in Berlin, the region where you and I are at the moment. Terry has a number of infections that is giving rise to concern. So there are possible lockdowns, I think, in sections of city or in certain regions. That is not beyond not impossible.
Well, the economic impact of a lockdown, of course, would be enormous. Germany's government has been spending a lot already to keep businesses afloat in this pandemic. Is the government prepared to provide more financial assistance if the pandemic worsens?
Well, the government is actually, in fact, at the moment passing the new budget for the coming year, and that provides a whole lot of billions, in fact, for fighting the effects of the pandemic. Direct assistance to companies is still possible, but the major assistance to companies at the moment is that if people have to go on shorter working hours, their companies are being paid, or the people are being paid by the state rather than being put out into unemployment. That is going to continue to the end of next year. At the same time, the number of investments that the government plans in order to counter the effects of the corona epidemic goes into the billions.
Hans, thank you so much. That was DW political correspondent Hans Brandt. In the city where the pandemic began, life appears to be returning to normal. Wuhan in central China was the first epicenter of the virus. At its peak early this year, the entire city of around 11 million residents was placed under a strict lockdown. New hospitals were built overnight, and critics, whistleblowers, were silenced, including this man, Dr. Li Wenliang. He was one of the first to report on the deadly disease, but 9 months later, Wuhan has a different story to tell.
It's the story of a re-energized metropolis, recast as a heroic victim of the coronavirus, thriving again. Traditional opera, for example, can be found outdoors in the crowded and well-to-do central city. China shows off Wuhan as a city reborn and saved, government media says, by China's efforts to fend off and almost send off the coronavirus that emanated from here. Now that everything is so good, what risks can there be? Wuhan, as the place where the epidemic broke out in the first place, I believe it must be the best managed. Things are so relaxed, they put together a massive pool party not long ago, attended by thousands of mask-less people. A viral video led to international criticism of recklessness. Beijing countering the party showed its success in taming the coronavirus. Wuhan has restarted. Life has returned to the kind of flavor we had before, so everyone living in Wuhan feels at ease. That easy feeling required a massive lockdown of millions. Wuhan was a near ghost town from all appearances last winter. This well after a would-be hero, the late Dr. Li Wenliang, sounded the alarm on the virus in Wuhan, but was quickly censored by the government. He died of COVID-19. Since then, 1 million more people have died worldwide. Looking at it from China's point of view, they've really done badly. Maybe they never really comprehended how serious this thing was. In Wuhan back then, many people left this world because of it. This virus is terrible. Maybe every country, like us, never imagined it would break out all around the world. I never imagined it back then. Beijing, though, maintains the world can learn from its handling of the coronavirus. A triumph, it says, even as it faces bitterness overseas from COVID-19 and the initial attempt at covering it up.
Let's get some more perspective on this story now. We can speak to Gabriel Leung. He's an epidemiologist and Dean of Medicine at Hong Kong University. Gabriel, thank you for joining us. As we mentioned, we've reached a really tragic milestone. 1 million people have died from COVID-19 across the world, and we know that the pandemic is still far from over. What is your perspective? Do you think we're going to see the death toll continue to rise at such a level going forward?
Yes, I'm afraid I do see an increasing or accelerating trajectory of hospitalization. And then, of course, a few weeks after that, you will start seeing rises in deaths as well. So as Europe is now going through the accelerated phase of wave 2, you will start seeing, and in fact, indeed, you have started seeing the age of the infected to go up from the younger age groups now into the older adult age group. And with that, you are seeing more and more being hospitalized. And then, as I said, in a few weeks' time, the death numbers will rise again on an increasing trajectory. And that is almost inevitable, especially as we now head into mid-autumn and then late autumn and early winter. That is quite a sensitive period to COVID recrudescence.
It is extremely worrying, Gabriel. I want to ask you about some of the regional differences we've seen, particularly with the death toll. It seems that Asia has actually fared much better than the Americas and Europe. How do you explain that?
I think that it's not just the deaths. Deaths is merely the tip of the iceberg. So I think that number one is the total number of infections in, let's say, East Asia, or for that matter, down under in Australasia. I think that those numbers are a fraction by 1 or even 2 orders of magnitude smaller than Europe or the Americas on a per capita basis. And therefore, when you look at hospital admissions, ICU admissions, and then deaths eventually, those correspondingly scale. And I think that it really depends on how hard you work at, number one, border restrictions, 2, the non-pharmaceutical interventions of testing, tracing, quarantining, and isolating.
Okay.
And I think that there are very remarkable differences between different regions in the world in terms of those key measures. And in fact, some of those then may reverse depending on the allocation on a global basis of the first batches of vaccines as and when they become available, I think starting towards the end of the year and the beginning of next year.
And Gabriel, just a quick question on vaccines there. We know that there are a number of vaccines are undergoing trials at the moment. When they become available and are safe to use, do you think that would really mean the end of the pandemic?
No, I don't think that that would be the silver bullet that many are imagining or hoping for. I think that the first generation of vaccines, with possibly 1, maximum 2 exceptions, most of them, virtually all of them, are designed and measured as outcomes and licensed, therefore, to reduce disease severity, not to stop transmission. And so that is a very subtle but critical difference.
We'll have to leave it there. Gabriel Leung, the Dean of Medicine at Hong Kong University, thank you so much for joining us here on DW. Now, Israel is halfway through a second coronavirus lockdown that was supposed to have lasted 3 weeks. But the health minister now says there's not enough progress made for restrictions to be lifted by the planned date on October 10th. Israel's lockdown is unpopular, but the government says the measures are crucial to stop the health system from collapsing. DW's Tanya Kramer has a look inside an Israeli hospital fighting to save lives.
Communication in this coronavirus intensive care unit happens only through a window and over a loudspeaker. Nurse Reut Abrahamov just finished a 2-hour shift on the ward. Now it's her turn to support her colleagues from the control room. The rotating shifts are hard. The patients on this floor are all in critical condition due to COVID-19.
One of the difficulties of corona is that a patient can be sitting with you, laughing with you, and 3 hours later he's in an induced coma and on a respirator. It can get worse very rapidly. The body just collapses, and it's not easy. People outside only see a lockdown while the economic situation gets worse. They see an increase in the case numbers, but not the people dying here.
Like most hospitals in Israel, the Rambam Hospital in Haifa has to deal with a dramatic rise in COVID-19 patients. Its corona units will be moved to this underground parking lot, 3 floors below the street. This vast fortified underground hospital was planned years ago in the event of war. Now the country is at war with the coronavirus, says the hospital's director.
The last 8 weeks, we saw another 600 patients. So, and the mortality is rising. We have lots of critical care patients. We currently have 70 patients in the hospital. 14 of them are ventilated, 2 on ECMO, and we see increasing needs of medical care.
The main issue for the hospital is having enough trained medical staff available for corona cases while still maintaining regular services. Upstairs, it's time for Reut Abrahamov to get ready to go inside the ward again for 2 more hours, her second time in this shift.
It's a very physical job. Our patients are unconscious. Many are overweight and are very heavy. Our protective masks fog up, and it's hard to see anything. And we sweat a lot in our suits. When we come out, they have changed color.
Most here have been on the job for many months now. The staff is prepared to go the extra mile, or hoping that the latest tightening of the nationwide lockdown will bring down infection rates.
Streets usually teeming with tourists are empty in Myanmar. Police are checking to see if everyone is adhering to strict lockdown measures. Nearly everyone has to stay home. And it has led to job losses. Poverty and hunger could be looming for an additional 38 million East Asians this year, the World Bank warns. Most of them are in Myanmar, where 85% of households are at risk of losing earnings due to the coronavirus pandemic. In Indonesia and Cambodia, it's 79% of households, and there's more in other countries. The World Bank says most East Asian countries have managed to contain the pandemic. Now is the time to help those who are most affected by the lockdown measures. The international lender says governments should do more to help the poor.
Global deaths from coronavirus have now topped 1 million. As the pandemic continues to take lives, it is also preventing people from being able to make a living. Key to getting the world working again will be testing, and testing fast. Now a Taiwanese firm has developed a robot that can return results within 3 hours.
Meet QVS-96. The Taiwanese robot boasts 3 arms, and it doesn't have to sleep either. If, say, its inventors QVS-96 were mass-produced, it could make a huge contribution to the world's economic recovery.
QVS-96S can produce around 2,000 results per day. With 100 QVS-96S deployed in JFK airports or Singapore airports, these airports can fully resume their flight and let the passenger travel safely and bring back country economy.
For now, though, QVS-96's operational radius is restricted to Taiwan, to places like this Taipei hospital. Normally, patients here have to wait at least 2 days to get their test results from the lab. The robot manages a turnaround time of around 3 hours, and it can distinguish clearly between SARS-CoV-2 and influenza viruses. This machine can be of great help when it comes to striking a balance between epidemic control and economic growth. It can help people come together and contribute to the economy again, while also effectively preventing the spread of the virus. And with infection rates rising in many countries right now, QVS-96 would have its work cut out.
Well, on this, let's cross to our correspondent in Frankfurt, Ashutosh Pandey. Ashutosh, the coronavirus continues to be the dominating feature for European economies. How are they coping?
Oh, well, Rob, the sentiments are certainly turning negative after seeing strong rebound after those restrictions were lifted earlier this year, after the spring lockdowns. So the sentiments are turning negative, and that's because the coronavirus cases are resurfacing, the cases are rising, especially in France and Spain. And these economies are dependent a lot on the services that they offer. And it's the services sector that's going to suffer a lot if the cases are continue to rise, and restrictions will have to be put back again. I mean, sweeping restrictions like the one we saw earlier this year. So these economies seem to be suffering there, but Germany seems to be performing better there, thanks to strong demand from China and also its strong dependence on exports.
And as we pass this 1 million deaths mark, how are some of the other major world economies doing?
The recovery is uneven. So the economies which are dependent on services, those economies are not faring as well as the others. And also those economies which are still struggling to get the pandemic under control, like India, they continue to struggle. If you talk about countries specifically, then China and South Korea, clearly they are the outliers. They are performing really well. The recovery has been strong thanks to the way they managed to hold on to the control the pandemic, and also because of government support. And US has been struggling because of all the bickerings over their stimulus plan. So that's a concern there. Emerging economies are also is still to come into the groove, and they are not performing as well. That's again because the cases are still rising in most countries in the emerging space.
Indeed. Ashutosh Pandey in Frankfurt, thanks for bringing us up to date. Now, if and when a coronavirus vaccine is eventually ready, transporting it is going to be a major logistical challenge. It'll have to be kept at a more than a little chilly -70 degrees Celsius. German manufacturer Vacutech makes thermal containers specially designed to keep sensitive goods at a steady temperature for days at a time.
This mundane-looking cooler is actually packed with cutting-edge technology. Each is tested before it leaves the factory to ensure that inside panels are 100% flawless. They have the special ability to maintain steady temperatures inside for very long periods, regardless of the outside temperature. Their inventor, Joachim Kuhn, is a physicist and developed the container's vacuum walls at university. His business model was born out of that experience.
Principally, our box is a kind of thermos flask in a box form or container form. Besides that, it's lined with special high-tech accumulator storage materials, which can store heat energy at a given temperature 10 times more efficiently than conventional materials. And this combination of vacuum insulation and heat accumulating materials is what delivers the long-term performance.
The coronavirus pandemic has put rocket boosters on Vacutech's business. The Würzburg-based manufacturer's containers have been used to transport some 300 million COVID-19 test kits around the world. The kits are temperature sensitive and have to be kept at a steady -20 degrees Celsius. But even if pharmaceuticals are the mainstay of the Vacutech business, they're not the sole activity.
The demand for temperature-led logistics is growing worldwide. We're not only talking about pharmaceuticals and biotechnology materials, we're also dealing with specialist goods like special chemicals, adhesives, optical equipment, and even artworks. There's a huge sector that requires constant temperatures over several days, and that's our business.
There's no obligation to wear masks at work here, though employees are tested for COVID-19 on a regular basis. Overtime's been the norm for months now, and Joachim Kuhn has warned his staff that it's going to stay that way. And if and when a coronavirus vaccine emerges, it will have to be transported at a constant -70 degrees Celsius in boxes made of these panels. That's when Vacutech will ramp up to 24-hour production.